This week's case of the week is from a doctor who has requested a 4-unit BruxZir bridge from a first bicuspid to a second molar, replacing the second bicuspid and the first molar. And the first comment here is, you've heard me say it a bunch of times, using a double arch bite tray like this for a 4-unit bridge, it's just going to make it really difficult for us to make a bridge that fits. Not a bridge that fits necessarily onto these preps, although that might be a little challenging in this case too. But when it comes to protrusive and lateral excursions, it's going to be really difficult for us to be able to really get something that we feel is going to be accurate in the mouth. So it might fit on the teeth itself, but the chances of it working in the excursions, we could do a lot better job for you with a full arch impression. So that's that with the impression itself. And now we'll take a look at the model itself and we'll kind of see what's going on here. And typically, you know, as dentists, we're able to see the buccal cusp pretty well and we can see what's going on here. And as I look at the reduction here, I can't really fit the perio probe between the thickness of the perio probe between the bicuspid and the tooth below it. I can on the molar, on the buccal, and that's fine, but I really can't here on the mesial aspect of the bicuspid. So that's going to be shorter than ½ millimeter. And again, the doctor requested a BruxZir bridge, so we're going to need at least a ½ millimeter here, preferably 6/10 of a millimeter, and maybe even 7/10. Well, preferably a millimeter, but minimally 6/10 of a millimeter. You'll remember the rule of 27 we've covered before too, so I won't look at that necessarily on this case, but I will look from the lingual at what's going on this molar. And that's where we really run into some space issues here when I try to fit the perio probe in between that. And that's the one that as a dentist, when we're looking from the buccal, is impossible to see. So when you look at that molar, you go, okay, that looks like enough room. And it is on the buccal, but it's not on the lingual. And it's really difficult to see that lingual because we can't rip the soft tissue off the patient's head and look at it from the other side of the arch as we can here in the laboratory. And that's why we're able to cheat a little bit, is because of the fact that we're able to look at it from this kind of unique view. So this is part of the reason why I found in my own hands I needed to go to something more like a prep by numbers technique using the reverse preparation technique. And so the reverse preparation technique, even though I designed it to be a universal prep in the days before BruxZir for EMACs and PFMs and things like that, there's actually a couple burrs on here that end up being really nice even for BruxZir. And one of them is the 6/10 of a millimeter depth cutter. I'll take this one out. We've got a 6/10 of a millimeter depth cut, we've got a 1.5 millimeter depth cutter, and we've got a 2 millimeter depth cutter as well. And all of these, we use the 2 millimeter, as you've probably seen me do before, on the occlusal surface for bilayered restorations. Even for EMACs, I'll use that as well. And the 1.5 we do for the axial reduction on bilayered restorations and EMACs. But this 0.6 millimeter tip is the one that I used to use strictly for veneers. And you can see there's not much of a cutting tip there. I mean, it's just, that's 6/10 of a millimeter. And really, this has become repurposed in my kit. This is my new BruxZir depth cutter. Because if I put a 0.6 millimeter depth cut into the occlusal surface of a tooth, like a second molar that I want to do BruxZir on, and then I prep the occlusal surface till I can't see this hole anymore, I know that I've reduced at least 0.6 of a millimeter, and I will have enough room for a BruxZir crown. So let's take a look at what this prep would look like on just an artificial tooth sitting in a stone model. So here is our 0.6 millimeter depth cutter. You can see there's not a ton to that, and that's how thin BruxZir can be made, but it does need to be made that thick. So I'm going to go ahead and place a 0.6 millimeter depth cut just on one of the cusp tips on this tooth, and then we'll take a look at what that looks like. So there it is. That's our 0.6 millimeter depth cut. You can see that the perio probe barely goes in there at all. And as you look at it, it doesn't look like much. I'm going to go ahead and reduce on both sides of that until I can't see that depth cut anymore, just to kind of give you an idea of how little tooth structure we're talking about. So as I finish this off, I can no longer see the depth cut. And I went just a little more than that. You know, I went with the burr a few more times and hit it just a few more times. Just trying to flatten it off. But that's going to probably add another 1/10 or 2 to that reduction. So it's probably going to take me to 0.7 or 0.8 millimeters. And we'll flip this and kind of look at how much reduction we've done. And it's really not a lot. It's about what we would do for cast gold. The only difference is with cast gold, we can actually take it down to 0.3 of a millimeter and it'll still be okay, but the patient just might chew through it. Now let me put a more traditional 2 millimeter depth cut next to that. So that's a 2 millimeter depth cut. You can tell there's obviously a lot more to that burr than the 0.6. It looks sizable in comparison, and it's over 3 times as long. And again, this 2 millimeter depth cut is what all manufacturers request for bilayered restorations, whether it's a PFM or a lava, that's porcelain fused to zirconia, or even an Emex crown at times. It can do fine at 1.5, but 2 millimeters is not going to make it any worse. So I'll put a depth cut on the cusp tip next to that at 2 millimeters. And again, with these self-limiting depth cuts, I can't go any deeper than that no matter how much I push on it. So as opposed to the 0.6 millimeter depth cut, this one looks a little more bottomless, if you will. And so let me go ahead and reduce that cusp tip down to 2 millimeters. Now you can see a little bit from the occlusal. It's a little hard to get the depth of field here on the camera angled like this. So let me see if I can turn it just a little bit. But okay. Well, that makes it pretty clear. We've got 0.6 of a millimeter reduction on this cusp tip, and then down there is where the 2 millimeters is on that cusp tip for a bilayered restoration. So obviously BruxZir, the preparation itself, is going to allow us to do a much more conservative preparation, which is going to be really helpful on teeth with short clinical crowns like lower second molars. The point being, we need at least 0.6 of a millimeter. So while BruxZir can do a lot of amazing things for a tooth-colored material, I really want to encourage you to get a depth cutter, whether it's from the reverse preparation kit or somewhere else. Access Dental has those MADC burrs. And if you're able to get that MADC 006 burr, that's the 0.6 of a millimeter self-limiting depth cutter. BruxZir will work very well there. And do yourself a favor, make that depth cut and then prep it till you can't see the hole anymore, and then you know you've got 0.7, maybe 0.8 of a millimeter of reduction. It's not much reduction, but it's enough for us to make you a BruxZir restoration that should last a long time.